Right.
People are like, oh, people are woke now. People have been woke.
Ain't
What
nobody
they
been
have
listening.
done was they've turned to face us. Whereas before, they just turned their back. That's not happening to you. Why do I need to lie about being beat up by the police? What
Right.
benefit what do I get from that? You know what I'm saying? It's like, I don't really understand. And why does it take that for you to believe me? I told you that these things were already happening.
Information is power, and we, the Federal Way Black Collective, consider ourselves a powerful vehicle of providing factual and relevant information to the public. We keep you up to date with education, youth, city policy, and politics, as well as current and relevant events that happen daily. We are sponsored by Rugged Genius, EvanCook.com, Pretty Grind Entertainment, Positive Vibes, located in the Commons Mall. Welcome back to the Federal Way Black Collective weekly live stream show, Thursday Thoughts.
Welcome back to Thursday Thoughts, everyone. Thank you so much for joining us. It is Thursday, and it is a good day, and we are all here, and I is tired. But I'm really excited to join you guys all tonight, and I have a special guest with me, Anthony Rivers, and we are going to unpack an interesting conversation, and that is about building trust in systems. So what does that look like for us? Hey, Anthony, how are you?
Good, how are you?
Good. Thank you for joining us.
Thanks for having me.
It is your first time on Thursday Thoughts, but it is not your first time with the Black Collective. I'm really glad to have you join us this evening. Traditionally, you join us in the background on one of my favorite projects, the South King Emotional Wellness League, which you were instrumental in bringing to life. Anything you want to say to the people to introduce yourself?
My name's Anthony Rivers. I've worked for King County, been with King County for almost 2 years now, working in various roles. Right now, I'm working in the COVID response since March, in various roles. And now I am working as the program manager for the COVID-19 vaccine for the non-healthcare sector. So.
Okay. So this is something we kind of kick around all the time, and I really feel like is the baby of Thursday Thoughts, is to have these couch conversations just to really bring things to perspective within the community. And I feel like there's a ton of conversations around social justice and definitely some equity in public health, some equity just in life in general this year. But I feel like maybe there's another conversation that needs to be had, which is, in order for those things to happen, what does building trust look like in our communities?
Yeah, I mean, I 100% agree. Building trust in the community is, actually getting the community involved. There's too many times when the decisions are made for us, or in our honor, supposedly, when in actuality, we weren't consulted with first. And that just creates the lack of trust. That creates mistrust, because you have people coming in with the savior complex, trying to save the day on topics that they don't even know about. They don't know if they are our concerns. And just because they are the concerns of public health, or they are the concerns of the entities that are coming in to do the work, does not mean that they're top priority on our list. Right. And I think having those conversations with us to know what we actually want and need is imperative in building that bridge
Do you think we have a list right now? I think one thing that comes to mind is when I get asked, right? Because we sit at tables with public health and they're like, what will it take to get trust within the community to make people feel that there's this, there's been this big declaration. Racism is a public health crisis. And so when I heard that, I was like, we went in. Like when I go to the doctor, they are going to hear me. When I go to the city office, I will be treated with respect. When I have requests, I will be treated with basic human dignity because the bell has rung, life has changed. And I'll admit, the last 6 months have left me wondering which bell rung, and maybe I'm uninformed. Maybe I don't know how to use the system, which also lets me know that I don't trust it still because I just expected it to work and it kind of let me down. But did it?
Well, I'll say this. Kudos to you for being optimistic because I did not believe any of those things were going to happen just with a pen stroke to say that we've declared it a public health emergency. It's been a public health emergency to us unofficially. And so someone who was not from our community coming in and saying, oh, it's a public health crisis. Okay, but what does that mean? With a stroke of a pen, that does not undo the racist beliefs of doctors that we still have to encounter. It doesn't undo all the systems that pen is not going to control. And so it's a great statement, and it's a move in the right direction. But to me, it's the equivalent of saying Black Lives Matter and fighting for social justice and telling them to stop killing us, and Band-Aid coming out with Band-Aids that match my skin. That ain't what I asked you for. Right. And again, being clear on what we're asking for and having those real conversations with us and addressing the elephant in the room. There's too many times, my thoughts are, if we're not talking about it, then in some way we're denying it.
Ooh, that's a good one.
Because we know the elephant is in the room. And if we go into the healthcare system to get care and we know that elephant is in the room and they're acting as if it does, you want me to get a vaccine, but you don't want to talk about the historical trauma. Or you're going to treat me as if I'm hard to reach when I'm not really hard to reach. I'm just not necessarily as willing to participate because I don't have the information that I need to be able to make an informed decision.
And that's another point too, because what do we need to have the informed decision? I feel like there's a disconnect there because it's not a vaccine insert. And it's really not just some insurance form, an insurance waiver. So I don't know that we have like the mechanism that builds that trust right now, but what does it even look like?
Well, to me, building that trust, again, is starting with community. Is asking that question. What do you need for you to feel comfortable? There's also a lot of conversation about what we have to do to get back to normal. We have to wear a mask. We have to get vaccinated. We have to social distance. We actually don't have to get vaccinated. That's a choice.
Right.
And I think if we reframe it and talk to people more about the choice that they have and unpack why they're making the decision that they're making, we can get further. But again, that's addressing the elephant in the room. And sometimes the entities don't want to take that time because they don't have time. It's that like, well, I built it, y'all didn't come. Well, you built it in a way that wasn't accessible to me. So, was it really for me? You built it in a way that you thought was going to be right for you, and you invited me along, Yeah,
because if you want me to come to lunch and my lunch is at 12, but you invite me for free lunch at 2.
Well, not only that, don't invite me to lunch and don't give me an option of setting the menu. If you invite me to lunch and you've already prepared the food, I was an afterthought.
It's true.
Yeah, you don't even know if I want to eat tacos. Maybe today I want nachos. Maybe today I want chicken. Maybe today I want pizza. But you have to invite me to the table to have that conversation about what's even going to be on the menu before you invite me to lunch. And that doesn't happen.
Do you feel like there's space for, I don't even want to just say the Black community, but I mean, honestly, community in general, because there's an interesting space within COVID where we've been limited. We're traditionally used to walking into offices and being able to have conversations, especially if we don't feel like we're getting our needs met like over the phone. Mm-hmm. And that's no longer possible. Like, it's just a lot more complex to do in-person business. So when and systems are like traditionally just all in person, like it's not like the Department of Licensing was coming to your house, like everyone had to go there. You have to go to do these things. And so we're all navigating them differently, and our priorities and availability is greatly changed. Like, we're at home with like all of our entire family. We've got our work at home, schools at home, activities at home, and then these a la carte menus in various access levels. And that even depends on if you're in a good space for the digital divide. Do you
you have to have access. Yeah.
And so when we're approaching like what you can have, how you can have these conversations rather, and what's needed for these conversations, I think a lot of that is we have to figure out what the baseline is.
Mm-hmm. I mean, it's figuring out what the baseline is, but it's also meeting people where they are.
I feel like for too long we focused on welfare programs, right? And so it's like, okay, we're meeting this need here, but we're not really like edifying people once they go to the next level. So they're kind of like in this space where you kind of have a way to get to, we can even use COVID language, right? Like, we're in phase 1 again. And I know a ton of people in homelessness or different areas of illness where they can get to phase 2 or phase 3, but getting to phase 5, they don't really have all the tools necessary. They only have enough tools to get them to their next crisis. Mm-hmm. And so we're literally training and okay with teaching people that living in crisis mode is acceptable. And it creates the need, once you have this in just complete lack of investment in mental health, now we're just completely disrespecting people's emotional health. And there's no avenue. And then, just go home, deal with it, and take whatever you're told.
Mm-hmm. Assuming you have a home to go to. Again, yeah, assuming that you have a home to go to. Again, that's our privilege. You know what I mean? We have a home to go to. We know it's going to be there. But for a lot of people, that's not the case. They don't even know where they're going to sleep, let alone, an address. And some of these same people are the hardest hit when it comes to some of these things. And again, it's going to where they are. It's, we can do all the messaging in the world on social media. I mean, not on social media, but we can do on digitally.
Right.
And if we're talking about people who are living homeless, do they really have access to that? So are we really talking to them? Are they receiving the message? And I mean, if you look across the board, language access, people living in rural areas, there's all these different things. We're getting the message out there, but are we meeting you where you are? Have I had a conversation with the Black community to find out where you get your news from? Am I just, we know. But am I assuming that I can put it on my government website, or am I assuming that you're listening to CNN? Am I assuming that you're listening to the local news? No. There's a lot of assumptions that are being made based upon a colonizer mentality. That's not where we get our information from. And if the bulk of us, if you know that there's a lot of misinformation on Facebook and a lot of people are spreading the word of Facebook, then maybe that's where you go to put the information out there. If I'm trying to reach people who are living homeless and I want to get messaging to them, I know they're not necessarily they may have a phone, but they may have to use Wi-Fi to access anything on that phone. Right. So to me, we have to think outside the box. We have to create a billboard that says phase 2B, it's your turn, and make it clear that people see it. Someone who's living homeless, they may be living under that damn board, but they will be able to see it. It's working with the entities that are out there. One of the biggest problems is I feel that a lot of times public health and government entities get in their own way.
Right.
In a situation like this, we know how people of color feel about the healthcare system, about public health. We know that there's been missteps in the past. They may not be happening currently at the level that they were happening before. But the fact of the matter is, there's options. And we have to make sure that we explore all of them to make sure that we're reaching everybody that we can reach. And like I said, that's across the board. That's regardless, that's social economic status. It's not enough to say, well, we've got these people left in this group and we're just going to move on. Well, if you do that in every group, I guarantee once you look at all of the data, you're going to see the people who have been left behind.
I agree. And I think the other thing is that we're talking even about welfare right now, and that's one, homeless people, right? But when we're thinking about from our communities, a lot of us are not in that situation, but we've still been hit differently in this pandemic. And so it's like, it's not about not necessarily having money, but the connection to resources and stable resources is still more valuable than ever, because you have to have a way to connect, to get your groceries, your doctor's appointments, to get to those things and connect your family and get connected to the information about what phase are we in? What are the options? When I start to think about even masks, right? When masks were like rolled out, they're giving one type of mask like for free at events, like the surgical, right? And then I look at in Congress, right? When I look, they have these spacesuits. So, and I'm not saying that we need to roll out a plan for that, but I'm saying, where's the discussion? I want to know the difference. I want to understand the difference so that I understand your investment in public health. Right. And there's not really any transparency there.
And I mean, and that's part of the problem, is there's been a lack of transparency in the processes. And, you know, one of the things that I talk a lot about is communication. We have to communicate. And, you know, I'm from the Pacific Northwest, but as you know, I don't do Pacific Northwest nicey, nice, just to be nice. I don't got time for that. It's too time consuming. And so, you know, I would rather talk to you and give you an answer that you don't necessarily want to hear than to leave you to come up with the answer on your own. Because you're going to draw your own conclusion based upon your history, based upon the way you've been treated, and all of those different factors. And I can eliminate that if I just say, you know what? I know you want it to be your turn, but it's not. And your turn is good. We don't have a clear answer on when your turn is coming, but we know it's coming. I would rather say that.
Truth feels better than the lie of just this, hold on, call back next week. We don't know, you know, like.
And it's also, like you said, it's just because I have health care does not mean I know how to use my health care. You know, I can have the best insurance in the world. I work for the county. I got good insurance. It's a government. I mean, we all know that what's there. I still have to know how to use it. And I'm still figuring out how to use it. And I am relatively intelligent. You know, I'm a normal person. You know, I speak English. My privileges, I'm a man. I speak English. You know, I still recognize the privileges that I have. And they exist.
As a Black man, I commend you for saying that.
It exists. Now, there's some things taken away, but but I still have my privilege. You know, I have things that other people don't have. I can turn a blind eye. I haven't. We're not gonna go there. I've had many issues. You know what I'm saying? And
I think I feel the same because I come from a public health background. I have the privilege of working in a large healthcare system for nearly 10 years. And I know exactly what I need to say. But you know what saddens me the most? The fact that I know what it cost me too. So I have to say certain things. You know, I demand you put this in my chart. I have to I know there's 3 tips that I get told as a Black woman if I have questions or concerns about my health. Like 1, ask them to make sure they notate in your chart why they're telling you they will not give you a test or whatever your concern is. 2, another one I've heard a lot is bring someone with you. Write down all your questions, or send them to the provider in advance, like through an electronic medical record system. And if you see like a diagnosis that's false, to send them a message. So you're creating a paper trail. And it's interesting because it's like, do I work at this hospital?
Right.
I'm trying to understand why the valid communication standard, which is dictation, does not accurately communicate the same experience I had in the visit.
Well, when you're relying on that doctor to write everything down, it's still based upon their interpretation. They're not writing. I mean, are you writing down what I'm saying word for word? You know, it's like I said, I've had, even recently, woke up one day and my foot was hurting. And it felt like my foot was broken. It felt like my toes were broken. And I was like, what happened? And I called my doctor and, you know, he was like, well, you know, it's COVID and we need to do this and we need to do that. And I was like, well, you don't do that on the phone? You're not a foot doctor. You mean to tell me I'm gonna go through this just for you to give me a referral? Oh, wait, with my insurance, I don't need you to give me a referral. I'll go get my toes checked on my own. And then they send me for x-rays and they're like, well, we don't see nothing. Well, before you even start, look at my chart. There ain't no history of me asking for pain pills. My foot hurts. I want a solution. I don't want a Band-Aid.
I don't know why you don't see nothing, but I also know that is not my problem.
Right. But the thing about that was a Black doctor. And I've had a relationship with this doctor. And something about him has made him too comfortable, where he feels that either he's forgotten who I am and that I've been a part of the healthcare system and I've worked in public health for a minute and I'm not the one. Right. But again, that's my privilege. You know, right. I know how to talk
about insurance authorizations. That's key. Because I know that off top, 90% are auto denials. Just because you won't force the issue and they know it.
Yeah.
But I'm privileged enough to know that the first denial is just basically to see if you care enough.
Yeah.
But then what does that first denial cost me as a patient? It means I've got to wait on hold, find a patient advocate, get my doctor, get a note from my doctor. What do you need insurance? Wait, y'all don't want to talk to each other? So it's my responsibility to do all that. Uncompensated.
Yeah.
While you're making $125 an hour. So it's like, to me, this is what builds mistrust. Yeah. It's like this system, like I know a couple months ago, they rolled out the transparency like in hospital billing. But like, I understand the move towards that. But I'm not sure it truly solved what they were attempting to.
No, I mean, that's, again, I'm asking you to stop killing me and you're offering me a Band-Aid that's matching my skin tone.
You're giving me a thing that says how much I owe for the possibility that you might not kill me.
You're getting in the realm, but you're still not helping me with what I'm asking you for. Exactly. You know what I mean? It's like you can change all of that, but what you can't do is undo the racist ideology of the doctors or the nurses or the staff that I have to encounter to get my care. And the stereotypes and all these different hoops, all these barriers, every time I encounter, especially as a Black person, I walk into the door and if the person at the front desk, the receptionist does not look like me and she had a bad day, then she's the gatekeeper. Then once I get past her, then I get into the room with the nurse. Now she's the gatekeeper. And then the doctor comes in. You know what I'm saying? So there's all these different factors that play into healthcare. Like I say right now, we can't open up, the NFL can't play because it takes more than just the players on the field. It takes people to operate that whole system for that game to play. And you can have the best doctor, if he got the worst staff, your barrier is still there.
Right. And
so honestly, you can change all your paperwork all you want to.
Because they're like, well, they just make notes or they just answer the phone. But that person that answers the phone is the one that's asking you about why you need to see a physician. They're the ones that likely spends the most time with the patient as far as just meeting the patient's day-to-day needs when they call their clinic.
Yeah.
And it's entirely too important to not have people that don't desire to build relationships.
I've gotten the organization that I used to work for, I'm not going to say the name, but they had, the front desk person was that person. This was an organization that served very vulnerable people. And when I went in there as myself as a client, I remembered her attitude. As I was an employee there, and I watched that same attitude with people calling, with people coming in. They weren't getting the services that they needed because of her. I made it my mission to retire her because she was causing damage to the community. And you as an organization, you need to recognize, and that person needs to recognize when their time has passed. Exactly. And if you have someone who is acting as the gatekeeper to services that could be life or death to someone, then you as an organization need to do what you can do to make sure that that person is bubbly, that person is giving all the attention to those people that they need. Because if I call you and I need something and I reach that person, I'm probably never going to call back. Because and now you're
you're letting it go.
It just means that I give up. And that means that my needs are unmet.
You know what? Interestingly enough, when you said that, it realized I don't think I've looked at much of primary care as a last chance, but it really is. Because when you go in, I mean, albeit if you're not going to like the emergency room, but for a lot of issues, you literally probably just ignore it for a long time. Like, you know, mentioning your foot hurt, right? You just get used to it.
Yeah, yeah.
People just get used to things. And that is why literally they end up like 15 years later and they're like, oh, you've got gout or something crazy, been like killing your body.
Yeah.
And you don't know, because when your body's senses were off, and when your body was telling you that you needed to talk to someone, you were emotionally intimidated by everything around, maybe it be lack of knowledge or bullying or just general intimidation, like whatever the case may be. And that window of when you had an opportunity to advocate for yourself and fish for knowledge and understand how to take care of you as a whole person, that door was systemically shut.
Yeah. And on top of that, we adjust to the pain. It's not like we don't hurt anymore. We just get used to living with it. And so, am I an angry Black man? I got back pain that I can't get no help for. Hell yeah, I'm angry. You know what I mean? It's like, you know, I get treated bad when I go to work. I get treated bad when I go out into the world. I get treated bad when I go out into the healthcare system, and I'm in physical pain that I'm trying to deal with at the same time because the powers that be don't want to listen to me. But then the catch to that is it goes on for so long, by the time you do report it, it's hard to say what level it is on the pain scale. In actuality, it's an 8. But you're telling them it's a 3 because you're so used to it. Yeah. Yeah. And so it's something that you're just living with because it's a 3, and now they're really not taking it serious.
Oh, not at all. No. You know what's interesting to me is when we talk about building trust, what I haven't seen is like an increase of at-home documentation. So I've never seen, and it may just be me, but I've never seen, and I would have expected to in this climate where there's multiple states that have declared that racism is a public health crisis, where is the education on keeping a personal medical health diary so that you can advocate for yourself?
Well, you can't, you're expecting the people who are just learning to be where we are. We know what we need. They're just getting to the point where they're just getting to the point where they realize, look, when George Floyd got murdered and all of that, and I hate to say it like that, but when these things were starting to unravel, and you know, I had people reaching out to me, there were special things happening at work, and all these different things were popping up, and I stopped and I said, hold up, I've been Black for a whole ass 45 years. And I have been dealing with racism for a whole ass 45 years. It took this for you to ask me if I was okay? I'm struggling on a day-to-day basis. When I get up and I walk out my front door and the lady that lives across the street from me looks at me mean because I'm Black and she don't want to acknowledge me. And then I get on the bus and nobody wants to sit by me because I'm Black. And this is all before I walk into the office. And then I get into the office and the person that I'm trying to walk into the secure building with turns around and looks at me to make sure I'm supposed to be there. And I sit 2 feet away from her. This is all before I even pick up the phone to do my job. But now you want to ask me if I'm okay?
No, but that's real. Because there's a lot going on.
There's a lot going on every day. There's a lot going on every day. Yeah. And so for you to wait until something of this magnitude to happen, for you to even be like, are you okay? No, I'm not okay. And stop asking me because you know I'm not. I'm not supposed to be.
Right.
Stop asking me stupid questions is usually my response. Are you okay? You know damn well I'm not. So, you know, it's, we have to, but to make those decisions, we have to be in positions of power. Right now, we're relying on the entity that, like I said, that just realized, and this is not, I'm not speaking of King County, I'm just speaking the United States as a whole.
Right.
People are like, oh, people are woke now. People have been woke. People have, what they have done was they've turned to face us. Whereas before, they just turned their back. That's not happening to you. Why do I need to lie about being beat up by the police? What benefit does, what do I get from that? You know what I'm saying? It's like, I don't really understand. And why does it take that for you to believe me? I told you that these things were already happening.
Someone that you know, living, breathing. Yeah,
it's like, why someone that you know, I told you my experience, but my words weren't good enough. You had to see it on the news. It's like, come on now. It's like you want to see me dead before you do something about it. That's not going to work for me.
Yeah.
That's going to work for the people who come after me, but that's not going to work for me because I'm not going to be here.
But the sad part is maybe or maybe not, because what has changed since George Floyd? There's been a lot of uprising, but I mean day-to-day life safety. What has changed for me or you as a Black person in America?
I don't feel any safer.
I don't feel any safer.
I don't feel any safer. And right now, with the heightened state of everything right now in this country, it's hard to feel safe. And we live in the Pacific Northwest, where we are definitely not the dominant culture at all.
Right.
And so, you know, I just bought a house, and it's sad, but I'm going to be completely honest with you. I know that there's people in this neighborhood that don't necessarily want me here. I've had thoughts, and every time I pull out my driveway and I close my garage door and I watch my garage door close, I watch it close, because one day I have a feeling it's going to say nigger. Or it's going to say something like that. And I could be completely wrong, but that's the anxiety that I live with every day.
Right. But that's real.
But it is real.
And the part that I think that is hard for outside people is that there's like this, oh, well, you have to wait for this. But no, you have to respect the fact that my experiences are going to go with me. So instead of taking that personally, I'm going to need people to try to make sure that they keep their entanglements with people on board, above board. Like, because how you act, like you're talking about going through the bus stop, like those little interactions, all of us know that can throw your whole day.
Yes. And then on the way, before you even do that, before you even leave to work, you see George Floyd got killed. That just sets your mood. And then boom, boom, boom. But before you even get to your job, you know what I mean? And it's like, you know, of course we all like our seats on the bus by ourselves. But when you realize every seat is full except yours on a constant basis, it has to start to affect you. Because it's like, well, okay, I don't necessarily want you here, but at least want to sit here. Right. You know what I mean? It's like, no, but people would rather stand up. People would rather do anything but sit by the Black guy or the Black person on the bus. And these are the things that I experienced. These are the things that I saw on a day-to-day basis. And so, you know, it's one day I looked in the mirror and I said, you're going to die. you're going to die early. And I started to cry because I have no control over it because of the stress that my body is under on a constant basis. Yeah. It's not healthy. We're not supposed to be, on the inside, I feel like I'm a hamster on a wheel running. And I feel like a lot of Black people feel that way because there's so much out there. Anytime the police get behind us, that hamster runs a lot faster.
Man, I'm telling you, I have never been in a position to be accused of a crime, but I will say that every time I've ever been pulled over, I felt deep in my soul I was going to prison.
Mm-hmm. Because you have no control over the situation. And people say, well, do this or do that. So you're going to victim blame me because I am the victim. Instead of changing the way that they interact with me, you're going to train me on how to interact with them.
Yeah, isn't it interesting? I thought that was interesting that ignorance is not it doesn't excuse you from something from the law. But I think that's interesting because it's well, why don't we do a better job, one, of educating our residents on how to be the best residents? They have police training. Where is resident training? Where do I learn the rules? Mm-hmm. Just literally. Yeah. RCWs, all that, you must do your own personal research, but public school doesn't teach you that. No. Systems don't teach you how to participate in systems, mm-hmm. which is why you can't trust them. No. They simply say, come in, and then you lose everything you know how to do. Yeah. And there's not a soft handoff. Mm-hmm. There's just that if you want this, you need to do this. There's no reciprocity.
But here's the thing, and I'm sure you'll get this. When we know the rules and we follow the rules, the game changes. So, and not to be a pessimist, but I feel like we can learn the rules all we want to. And just like I told that person in that scenario, if I am a Black man and it's midnight and I'm on a side road or something and I get pulled over and I'm like, no, you can't search. It's just me and him and maybe his body camera. But do I still have power? In that situation? If he decides, well, I'm going to do this or I'm going to do that, how much power do I really have? I take his name, I take his badge. What does that do for what just happened to me? You know what I'm saying? And so it's hard.
I think that's a big part of the reason why there hasn't been a build of community trust, because there's that barrier. You can clearly see the accountability standards as a community member. You will go to jail, right? Yes. If you don't do X, Y, Z. But there are not real clear accountability standards within systems, right? You escalate it to themselves. Yeah. You want to get a manager within the system. And I'm not really sure how that adds up. Because 1 + 1 should always equal 2. And to me, that equals 0. But I think that these are the kinds of things we have to begin to entertain. It may not make the most sense on paper all the way. But right now, let's be real. What we're dealing with definitely doesn't. By definition, there is no way that people will feel comfortable with our systems if we do not change the manner in which they engage with them.
Yeah. And that comes to me, in my opinion, that comes from independent review boards. That comes with checks and balances. Because as long as people are able to do things in the dark, we have to trust that they have the right intentions. And we know that that's not the case. And you can have the best intentions and still execute it wrong. And if you haven't talked to me, then you're going to execute it wrong. And so I think it's a matter of checks and balances. It's having people who are not a part of that system, making sure either people who are not a part of that system or people who are the recipients or people who are on the other side of those services monitoring and reviewing and making, and you having to be accountable to them.
I like that. And I do see that, not all the time, but I have seen good models within housing investment projects. Not all of them, don't get me wrong, but in community housing investment projects, I've seen investment in conversations and stakeholder planning groups. And I agree with you. I think that counts. I think that matters. And honestly, I believe that's how our government was designed to function. And that's what's missing. Yeah. When you say the system's broken, it's absolutely not. It's working as it's designed, it's supposed to, but it's broken. Missing the human element. We were always supposed to be a part of this story. And any effort to limit the community voice is an enemy of democracy and an enemy of all people.
You better say that. Because that's real. And that's really what it boils down to. That's the way that government is set up. But if you look at businesses and you look at other entities, they're not necessarily set up that way. A lot of times, is it good for their bottom dollar necessarily? Sometimes no. But to make sure that things are equitable, to make sure that things are, if there's a checks and balances, that means balance. That means you can't do the thing and judge the thing and make decisions about the thing. It's like, well, what about the balance part of it? There has to be some other, and to me, it's like, the way that I look at it is like, I tell people all the time, we don't have to always agree. We shouldn't always agree, because if we always agree, somebody is fake.
Right. Somebody lying.
Because we're not the same person. And, we have different experiences that got us to where we are today. But that disagreement is how we grow. If we're all just thinking this way, then we're all just moving along thinking this way. But it takes somebody else to come in to say, well, what about this?
I agree. Someone shared with me, and I carry this with me always, that the purest form of love is having that conversation. Love me enough to be honest.
Yes.
Respectfully.
Yes. Love me enough to be honest.
Because
and that's
being like a yes person from either perspective. Because even when you go to your doctor, like if they're just like, oh yeah, that's what we're talking about. Like, that's not trust. No. If I don't trust that you're telling me something, and I can't trust that you're willing to be a thought partner to help me grow, then there's not going to be what I need to be a good community member, to even be a good community person, to participate.
Yeah. And that's part of getting good service. It's like, that's like having a therapist that just lets you talk the whole time.
Yeah.
I can talk to my friends. I need you to give me some insight on why I'm doing the things that I'm doing. It's a collaborative effort, but you can't just sit there and let me just talk, because then you're not doing your job. And if you're not doing your job, then what am I paying you for? Again, I could be talking to my friends.
Or myself.
You know what I mean? So yeah, it's trust in the community. It's going to take work. It's not going to be easy work. It's not going to be conventional work. It's going to take stepping back and giving people the space to actually say what they need to know. Give people the space to say what's bothering them without threat of penalty.
Oh, that's a good one. I feel like that is really, really hard in the medical community, because especially like with doctors, you've got your doctorate and you want to feel like respected, and you want to feel like your patient trusts what you say. And if any doctors are watching that, I just want to let you know, patients that ask questions are not saying they don't trust what you say. They are saying they'd like to have some dialogue. And if you react in that moment like it's about you, and they like owe you some, I don't even know what to call it, but they just owe you agreement, then you're not doing your job as a provider. Because you have to provide them care and provide them knowledge and space.
Yes. And, you know, with doctors, I lost my train of thought.
They are doing their part.
That's what I was going. There's a hierarchy, and we sometimes feel that we can't say something to a doctor because they are the authority figure.
Right.
And because we know what it takes to become a doctor. Most people know what it takes to become a doctor. Most people they hold doctors on a pedestal. That's why we're taking their advice on our lives.
Right.
The problem with that is doctors know science. I know this. We have to work together. This is a full-time job. So you may know science and you may know this from a different level, but to know me and to know how to treat me, we got to put science and me together.
I think that's even a thing that maybe, because the interesting thing is, like, yes, racism is a public health crisis, and Black and Indigenous people of color are affected so much more by the disrespect for our needs. But the reality is, all of us are suffering from that level of entitlement.
Yeah.
From our providers.
Yeah, because there's always going to be a hierarchy. If it's not your color, it's your economic status. I know people, and I've worked with people who living homeless, people who use drugs of different sorts, and they won't go in the healthcare system because of the way that they've been treated. Life in that situation.
Their circumstances would change if they felt safe in the systems that were, quote unquote, designed to support them.
Right. So what I would do was go with them because it ain't gonna happen on my watch.
That's how you reimagine services, though. You have to decide to be an equal partner in your client's success.
Yeah. It's also modeling. It's also modeling the fact of you have a voice in this office.
Yes.
And this is how we're going to use it. The doctor, we're going to do it this way. Hold up. No, we're not. We're not going to make this person come back because it took a lot to get this person here, and you're going to respect that fact.
Oh, man, that is a huge one. The respect of time. They act like you just better live in this office.
Yeah. And
even when it comes to the respect of, like, the appointments, like, that is regardless of your socioeconomic status or race. When we think about how, like, medical appointments happened pre-COVID and we see how things shifted to telemedicine, my time is way more respected.
Yeah.
I don't mind waiting, sitting next to an app, ping me when you're ready. But for you to have me drive, pay for parking, sit and wait, and then I'm also paying for the privilege of waiting. And then, oh wait, it gets better. Then you get in that room. And then they rush you.
Or I can't tell you how many times I myself have sat in a room where it's like, wait, I've been in this room for 45 minutes.
Right, like, they have some nice magazines.
Like, you did schedule this appointment, right? And then they come in and they say, well, this happened. I don't care.
And that's not something I can take to my boss.
I don't care. You know what I'm saying? And again, we are privileged to have the flexibility where we are right now to be able to take a little extra time if we need to. If we have to be at work as an essential worker or something like that, and we have less flexibility, maybe we have a kid that's been sick. Maybe we're on our last leg, with this employer, and now I have to go to this doctor's appointment, and now you're dragging while I'm sitting here waiting for something that should have took 15 minutes. Here it is an hour later, and now I got to get back on the bus. Right. I got to get to work. I got to do all these things. Like, come on now. And that's why the benefit of where we are now with things going remote is you've gone through these things. You've gone through these changes to make things available remote. Right. To not put that burden on people. There's no reason to go back.
I think that's a really, really good point. Building trust in the communities, maybe looks like expanding the tools that we've changed to increase access. Because obviously it became such an issue because they could no longer access revenue without going back to the people. Mm-hmm. So keep that same energy when the world reopens. Make sure that you prioritize what matters to the communities that you need to stay open. Because the reality is a hospital is a building that can remain open, empty without patients. And so I think it's really important that we focus on what our patients need, especially now because people are scared to go in hospitals because of the exposure rates. So we're going to have to build trust, and it's going to have to be real trust. Yeah. It can't be fake. It can't be temporary. It can't be like quickly slapped together, and it damn sure can't be performative.
No, to me, it's got to be honest. I will not build a relationship, period, personal life, professional life, that is not built off of trust and honesty. Mm. Because if not, you're building a foundation on something that is not stable.
Very true.
And if you build it on trust, then you know going in, there's strength in trust. There's strength in honesty. And yes, there has been plenty of missteps, but acknowledging those missteps, and because that's the elephant in the room, is acknowledging those missteps and asking, I know that these things have happened. What can I do for you? Not what can I do for your community? You're in front of me right now. This is about you. This is individual care. This is not about the community right now. What can I do for you to make you feel better about me providing you care in this space? Doctors don't take that time.
That's true.
And if we were able to take that time to have those conversations, again, we don't grow up with the luxury of having a pediatrician that we keep until we're 17 and then transition into a primary care doctor when we turn 18 and built that long history of relationships with the healthcare system. Our white counterparts do in many cases. So again, it's not a matter of saying, well, we built it. It's a matter of, yeah, you built it, but I got here a different way. Acknowledge that and have a conversation with me about me, not about in general, but have a conversation with me. If I am hesitant, and let me just say this. I got into public health because my mom, myself too, but because of my mom and my mom's relationship with the healthcare system. My mom went in to the doctor. They checked her and said, Barbara, we need you to come back. We need you to go through this CAT scan. She said, I'm scared. I don't want to do that. By the time my mom went back to the doctor, she had a huge grapefruit-sized thing under her arm.
Wow.
She had a tumor in her brain, and she had breast cancer. That was irreversible. And if she would have had a relationship with someone in that hospital that would have said, Barbara, I know it's scary, but this is what's on the line. And actually trying to work with her to get her to go through that process, we would have found that cancer early. By the time we found it, she had 6 months to live and she made it 6 months.
Wow. I
said, and I ain't gonna cry, but I said that can't happen again. Not to anybody that I know. Do I necessarily blame her doctor in that situation? No. But I do still blame the healthcare system because it's her trauma with the healthcare system and her lack of a relationship with the healthcare system and their inability to want to take a step back with the healthcare system that took her life. Because if they would have been able to take a step back and say, this is what we need to do, explain it to me, bring other people in who could actually talk to her. She may be alive now. My mom died when she was 48.
Wow.
I'm 45. And the way that I saw it was, I have to do something. If I'm going to make a mark in society, my mom died at 48. I could die that early too. I better do something now. And part of that is Black health matters, and getting people to understand that preventative health is better than using the emergency room, and being able to advocate for yourself. That means I have a pain, and actually talking to your doctor about it, feeling empowered, like you said, actually making a list of the things that you want to talk about. Because once you get in front of the doctor, a lot of times people forget. They forget, they feel intimidated, they get rushed. A program here in Oregon with some folks that I work with, they were actually coming up with cards that people could actually take to the doctor with them and just hand it to the doctor. And maybe it's the wife that did it for the husband, because we don't go until men don't go to the hospital. We don't go until our mamas, our aunties, our grandma, our wives. You know, it takes somebody else to tell us, go to the doctor, because we got more important things to worry about. And so, you know, we created these cards.
I will argue that's not true, but okay.
Well, in large part, it takes someone in a maternal role a lot of times for us to listen. Right. Because
because there's trust. Right?
Because of that trust. We won't trust when the doctor says, you got a bone sticking out your leg. You don't notice that? And you're like, it don't hurt. Let your mama come in. Take your ass to the doctor. Okay. Myself included. Yeah. Again, I'm transparent, so I'll put it out there. I found out I was living with HIV. I was scared. I wasn't going to the doctor. I had made the decision, like my mom. I had made the decision I was going to be with my mom. I was not going to get treatment. I was not going back to the doctor. I was not going to do anything. I was just going to let it take me. I talked to my best friend's mom, who was this little Italian lady from New York that kind of reminded me of like Sophia Petrillo from Golden Girls, like that stereotypical like Italian woman. Yeah. And she was like, you did not just call my son and give him this information. Oh, you going to the doctor. And that was what I needed to go. I had made the decision that I was not going. And if she wouldn't have told me, oh, you're going, and it's not an option. And she was in Florida. She couldn't make me, but just that part of it was someone who cared enough to force me to go, to say, this is something that you need to do for your life.
Right.
All of those things was like, but again, it was somebody that I also trusted and respected. That was like, no, you're not going to do this to my son. You're not going to do this to me. You're going. And I've been in care ever since. You know what I'm saying?
That's what we all need.
That's what we all need.
Honestly, we all need that. And I feel like there's space for that in the healthcare system. We just have to decide that it matters enough. And I kind of argue, like, I'm not sure why it doesn't. When you interact with the healthcare system, it's arguably the worst experience of your life, not just because of the experience with the system, but because of what your body's going through. Like in this entire conversation, let's just start there. We haven't actually talked about really what the person's going through. We're talking about what existential things are doing to control how a person may respond.
Yeah. And that's one of the problems. I got all kind of issues, but that's one of the problems that I found with even looking for help with mental health. Mm-hmm. Looking for help with mental health is so overwhelming that when you have to do it when you're not in crisis.
Right.
Because once I was in crisis and I was looking through therapists and I'm looking through all these therapists, I was like, I can't do that. I don't have the patience.
I know, they kill me with that. Call and see if they take your insurance. If I am looking for a therapist for anxiety, depression, things like that, which are just staples of, especially in the Pacific Northwest with all the darkness, just like depression is a huge thing. I honestly am not sure why you think I have the time to call around and be rejected.
No.
Either they, whether or not they're taking patients or if they take your insurance, like, I just need you to find me someone that will talk to me.
Yeah. And that just don't exist. It just don't exist. There's numerous problems with the healthcare system, and I mean physical health and mental health.
Right.
And it's failing us in a bad way. It's failing us in a bad way because we don't know how to even know when we're going through something as far as a mental health crisis. We don't know what depression looks like to even be able to check ourselves, or for you to recognize it on me. And, you know, when it comes to like suicide, a lot of people of color, they're just not open to therapy. Right. Just not open to it. So who's going to be the person that saves that person's life? It's going to be us.
Who's going to be the person that teaches our community that that's not even the only kind of therapy? Because like what's interesting is as we've unpacked like this talk therapy, well, there's group, there's music therapy, there's water therapy, there's animal therapy. Who's to say that talk therapy was ever the vehicle for our community?
Right.
And why, I know that we're just a little bit new to the party, but we've got to find ways for our providers to share all the resources. Don't just give me the little piece of it. Yes. There's a lot of ways to address mental health concerns. And the reality is not everyone's insurance takes every provider and all those things. So you've got to get creative, and we've got to get creative how to solve issues within ourselves. So just like you promote eating healthy, promote treating myself healthy, have conversations with me and give me more than the 15 minutes. Let me upgrade myself to 30 a few times. Because look, guess what? I could tell you do it sometimes because you always late to my damn appointment.
Right. So you spend this time somewhere.
You don't got that extra time for me.
And that part. Oh, I had to tend to. I don't care.
But you rushing me up out of here.
Yeah. But and see, I won't do it. I'm just not in a place in my life. Again, that's my privilege. Is I've learned better. I've learned to advocate for myself. I fired my doctors. I'm working on firing the one that I got now. Because
preaching to the choir, they acting up in this COVID.
When you start acting brand new,
acting like I ain't got no options.
Yeah, it's like what I need you to know now is I'm not in the position I was when I first met you. When I first met you, I had public insurance. I didn't have the options that I have now. I don't have to deal with you now if I don't want to. I don't have to be in your system. If you're, and I think that's something that we need to learn to exercise as well. We don't have to be in every system.
That's true. And I think that's like
working,
a complex level of understanding of like switching doctor groups and understanding how to manage like your insurance and like changing your provider set, switching from, whichever system you're a part of, like you don't have to stay tied there. And even if they tell you, because that's where your PCP is with your insurance, you can ask for external referrals. Now, I'm not going to say it's easy. I'm not going to say that it's free. There are levels and it depends on your coverage. But where's the system navigation for that?
And that's part of that trust. There needs to be, again, and that's also meeting people where they are, like I said in the very beginning. We have to meet people where they are and stop assuming that everybody is in one place. And that's what tends to happen, is this one size fits all model. That's not equitable. No. We know it don't work, because if it worked, everybody would be great. But it's clear data that says one size fits all don't work. The issues, the intersectionality between my issues and someone who's Latinx is different. My issues and your issues could be different because of our gender differences. There's a lot of our age differences. There's so many things. And so again, I need to be looked at as an individual, and I need you to talk to me about me.
Right.
What I need. It doesn't take that long for a doctor to ask you, or for someone to ask you, what do you need? And not what do you need, what you want.
Right.
But I understand that this is the journey that you've been on. I've looked at your chart, I understand that this is the journey that you've been on, whether it's through the healthcare system, whether it's just acknowledging the historical trauma, whether it's acknowledging racism. I understand that this is the journey that you've been on. What do you need from me now? What can I do to make sure that we build a relationship that you can trust? But I feel like a lot of the healthcare professionals, I think they don't count on us seeing them regularly. They don't count on us building a relationship because that's not a lot of our nature. But we have to change that. We can allow the historical trauma to still affect us, and it will still kill us.
That's very true.
Or we can look at the changes that have happened, educate ourselves, and make it to a better place. Are there still things that aren't unethical happening? I'm sure. But we have a lot more access to information than we did even last year, the year before. We have access to information. We have the ability to find things if we want to. We also have to take that responsibility of doing our due diligence to make sure, to know what our options are, whether that's working with someone like your organization to figure it out, whether that's, talking to friends and family members. There's also this big secrecy. We don't talk enough in the community to be able to support each other. There's things I assume that you know what I know. That ain't necessarily true. But what you know could save my life. But it's not really a thought. But it's still important. And I think, we can have the conversations with each other. We need to educate ourselves and do our own due diligence. Not just get our information from Facebook. We need to actually find credible sources to get our information from.
My show is on Facebook. It's very credible.
But we also know what you're doing is balancing the misinformation that's out there. Yeah. Because there's so much misinformation out there. We need things like this to combat those things, because people will gravitate towards those because it's sensationalism.
Thank you so much. That means a lot. Anthony, I appreciate you so much. And I know that the county makes y'all get up early. So I really appreciate you for staying on so late with me. We are definitely going to continue this conversation, guys. On Monday, make sure to check out Alfred White with Health and Wellness Mondays at 6:30. They are going to 1 hour, and I'm going to hop on and join Dre and Alfred this week and a little Penelope. So I'm really excited to talk about adverse childhood experiences with a baby for the first time. And we're going to continue to have conversations like this. Please make sure to check out our South King Emotional Wellness sister page, SKEWL. To stay tuned. This week was our very first weekday event, and we're going to continue to have monthly virtual emotional wellness support groups. And we have so many other exciting things planned for 2021. So thank you so much for joining us this evening, and we hope you guys have a great night.
And before we go, there's one more thing. We have our Let's Talk MLK Day that is going to be happening on Monday the 18th from 4:30 to 6. You can find that information
that on our page on the Federally Black Collective and the South King Emotional Wellness page.
Yes.
Join us. Bye, guys.
Bye.